Okay, first we have hallway 3. He's a 68-year-old male who walked into triage with his wife. He's a non-English speaking patient, but his wife can help communicate. He complained of right lower quadrant pain when onset of 7 hours ago at midnight, and he's rating his pain at a 7 out of 10. He did not take any prior pain meds before arrival, and he was given 4 milligrams of morphine at 6:30 a.m. And a liter of normal saline bolus was started as well. Labs were already drawn, and it's just awaiting istat creat for CT ab pel with contrast. He's anal times 3 and ambulatory. Next we have room 7, who is a hold and tele patient. She's a 45-year-old female, and her diagnosis right now is DKA, so her chief complaint was puking and pooping. She's anal times 3, and her blood sugar was 150 at 6:50 a.m., and she's on insulin drip at 0.05 units per kg per hour, and she's also at D5 normal. The rate is at 150, and she was given 2 liters so far. She is on an NPO diet, and there's a bedside commode. She's anal times 3 and ambulatory. She has Reglan due at 7 o'clock, and she was a hard stick, so she has a 22 gauge in her left wrist and an 18 gauge IV in her right foot. Next patient is hallway 9. He was a 51-year-old male who presented to the ED straight after his flight back home from Vegas. He was feeling dizzy on the flight home, and went up to get to the bathroom, and had a syncopal episode in the bathroom for about 10 minutes. When he came to, he was woken up to a nurse taking vital signs on the plane, so he went straight here after arriving. So right now he's anal times 3 and GCS is 15. So there's no neural deficits, and he does report numbness that started a week ago in his left arm and wrist, and as well as cervical pain from the fall. So again, no neural deficits, and just awaiting labs. Lactate and ABGs. CT head is going to be due soon. It's a dry scan, no contrast. We also have room 6. He's a 72-year-old male who is a hypertensive crisis. He just arrived not too long ago at about 6:50 a.m. His last blood pressure reading was 217 over 95, and he's from YNI Comp. He came with back pain and hypertension, and YNI Comp told him to transfer over here ASAP to rule out an aortic dissection. So we are starting a line, and gonna get into CT for CTA or the ASAP, and that is it.